Bowel cancer obviously is a big problem, and we need to find a way to screen people on a population level to see who might be at risk of having that condition, to try and pick them up early so that we can intervene early, give them better outcomes, give better outcomes for the health system, and prevent patients ideally from getting bowel cancer.
Right, yeah. So you're taking people that don't have a problem currently and you're just trying to look to see if they could be at risk or have early changes.
That's right.
So I understand there's been some recent changes in bowel cancer screening. Can you tell me about that?
Well, look, it's interesting because in the last few years, there seems to be younger patients getting cancer. It's very anecdotal, but we are getting that feedback saying younger and younger patients are actually presenting with more advanced conditions. Whether that's a result of our diet, lifestyle changes, it's hard to know. There's probably a range of factors that are contributing there. But the guidelines have recently changed. So we've got a fantastic bowel cancer screening program run by the government in Australia, and everyone from the age of 50 to the age of 74, every 2 years gets a free bowel cancer screening kit sent out to their homes, looking for microscopic blood in the stool, which is an early sign of potentially bowel cancer among a range of other conditions like polyps or hemorrhoids. Mm-hmm. But it's a good way to pick up cancer. So because of this sort of trend towards younger patients presenting with the condition, the government has recently changed the guidelines. So screening is now available for patients from the age of 45. So instead of 50, from the age of 45 onwards, patients can have a chat with their GP or request directly from the bowel cancer screening program to have an earlier kit sent out to them.
Okay, so the change has been the age, which was what was?
So it was 50, and 50? Now it's screening from the age of 45. This is for patients, on a population level, correct. No other risk factors, no genetic syndromes where they might need earlier screening. Yeah. Just for all comers basically.
So asking for a friend, but if you had hemorrhoids and you have fissures in your bum, should those people still have those poo samples done, or is it inevitable that it's going to be positive?
Look, hemorrhoids are very common, and they do obviously have a much higher rate of getting a false positive result on the screening test. But having said that, the amount of times patients have had hemorrhoid type bleeding where we've found other pathology once we've done the screening program, and then once we've gone on to do their colonoscopy, if anyone has any bleeding, any change in their bowel habit, that automatically puts them at a higher risk. So I would definitely recommend having a chat to your doctor about further assessment.
Yeah, okay. Thanks for your time.
Thank you very much.